Hey guys, my name is Kristen Mullins, and today I'll be presenting you my community assessment. My assessment and my windshield survey was done on the town of Wise, Virginia. So, what is a community assessment and why are they important? So, a community assessment is kind of like a way to gather information about a specific area, look at the health status and resources that they need, and help identify disparities and opportunities for improvement. So with this community assessment, there's several different ways that you could do a community assessment, but for this assignment, we were performing a windshield survey. So a windshield survey is a type of observation where someone walks around or drives through the community to assess the physical condition as well as social or environmental conditions. The purpose is to identify health concerns within our chosen area, look at the resources that we have available, and also help us identify nursing interventions and diagnoses. So again, the community that I will be talking about today is the community of Wise, Virginia. It's located in Wise County. We are in Southwest Virginia. We are right next to Kentucky. We border Kentucky, and we're only one county away from being in Tennessee. The zip code for Wise is 24293. You can see here is the town of Wise on a county map. Wise is very centrally located. Up here we have Pound, and this right here kind of takes us to Kentucky. And then we have Coburn over here, St. Paul, we've got Appalachia, Big Stone Gap, and this right here is the city of Norton. We're directly beside the city of Norton, and many of our Walmart and many of our shopping opportunities are here in Norton. Wise is the county seat for Wise County, Virginia. It's a very heavily trafficked area. It's the location for many offices, like our health department is here, the courthouse, social services, health department. All of those offices are located here in Wise. So here is talk about the geographic assessment. Wise is mostly made up of mountainous terrain and is bordered by rural communities and small towns. There's a lot of mix of forest areas, and there's many hills and mountains nearby. We're basically directly on top of the mountain. Wise is very high in elevation, even compared to the rest of the county. There's also a mix of residential and business zones. I'm going to show you a little clip here of a road that I live really close to. It's just kind of like a foresty area here, and it's really pretty. But this is just what some of the roads look like close to Wise. So the town of Wise, it runs alongside US 23. US 23, it takes you to Kentucky or Tennessee. We do not have an interstate or anything near Wise. It's the nearest one is really about an hour away. When you enter Wise, for the most part, you're coming off of US 23. That's where the main, three of the major entrances are. All of these entrances, something interesting about them is they all go uphill. Like I said, Wise is at a very high elevation. Our average elevation is 2,474 feet above sea level, which even I think at Big Stone Gap is just in the 1,000s range, so we're even quite a bit higher than Big Stone Gap. Due to this, our terrain is very spread out. It's spread out among a lot of land. It makes access to shopping or getting around difficult for some people who don't have a vehicle, like on foot or bike. It can be really challenging. So let's talk about the homes and housing and zoning here in Wise. So most of the homes in Wise, they are single-family homes. There's really not all that many apartment complexes. There is a major complex really close to UVA Wise, and there's also some nearby, but really not an excessive amount of apartment opportunities. We do have a lot of mobile homes here. There are I think at least three mobile home parks in Wise close by, which they do have very close access to town. When you are driving through the town of Wise, something that you notice, especially in more central Wise, like in downtown area, it's very well maintained for the most part. Some of the homes are well maintained. Their lawns are very well groomed, and they're very kept up with. When you go kind of on the outskirts and you get more out towards the more rural area, you may see some signs of aging and damage to homes. There are also some homes that will be abandoned. So here is a little clip of the town of Wise. There's a few buildings and homes that are directly in the center of the Wise. I'm going to play this video and I'll mention some of the businesses here. So over here to the left is the courthouse. This right here is the Inn at Wise. Over here is a Mexican restaurant. This right here is a major business, and it is called Thompson and Litton. They do like contracting and things of that sort. These right here are some historic homes in Wise. This one, there's 3 here. And when you come into Wise off of US 23 and you enter in by McDonald's and you come to the first red light, this is what you see. So it's honestly a very beautiful view. And as we go on here, directly to your right here, this is an ambulance service. It's kind of like a private owned service that takes calls and things of that sort. Over here is the post office, and you've got a tire service shop here. And on up the road from here, there's a couple pizza shops and restaurants. And also there's a bank up here, and this is also the road that takes you to the Wise County Health Department. It's on up the road on the left. All right, so let's talk about some of the shopping opportunities that we have in Wise. In Wise, there's kind of a limited number of shops to visit. There's only really a couple of grocery stores. One of them is called IGA. It used to be called Payless. I'm really not sure what is even on the building anymore. This little shopping center is directly in town. Now, when you go out towards US 23, we have a food city. It's right along the highway. And like I said earlier, there's a Walmart in Norton. It's really close by. Many of the shops that we do have are across US 23. So like Marshalls and things of that sort, you have to go all the way across the highway, which makes it really difficult for those who are like walking on foot or on a bike. Like we also do have a Goodwill. There's furniture stores and clothing stores like a Belk, home supply stores, farm supply stores, and all of that. But most of those are located across the road. But this right here, this little shopping center right here, this right here is directly in Wise. I'll let this play again for a minute. And then here is a clip of an area. This is right along US 23, right on the other side. Here on the driver's side of this vehicle is the highway. We have a pretty large gas station right here. Then back here is our Lowe's. We have a Lowe's back here. We've got a Taco Bell. And then right on the other side of the stop sign, we have a Food City. And Food City is where many people do their shopping. This right here is like really our biggest grocery store. And it's directly on the other side of this Lowe's here. And there it is. All right. So, talking about other businesses, Moz, we have many other business types. We've got other local restaurants. We've got two pizza restaurants. We have like a grill type restaurant. They have like burgers and hot dogs. It's called K&E Sweets. They also have like milkshakes, things of that sort. We have a Mexican restaurant that's located directly in town. It's really close to like the schools, and right across the road from the courthouse. As also too, there's another one that is in the shopping center that's across from US 23, and we also have two Asian restaurants as well. Um, in town, we also have other businesses. We have HVAC offices, property management companies, car washes. There's three hair salons, businesses such as law offices located near the courthouse. There is also a laundromat that's open 24/7 that is located. It's directly in town. It's in the same shopping center as the IGA. So employment wise, when you were looking at the town of Wise, directly the biggest employer is going to be UVA Wise. They employ many different positions at the college. Another major employer is going to be Wise County Public Schools. You also have public service agencies such as the Health Department of Social Services. There's also a large call center. It's called Found Ever. It used to be Sykes. That place and they employ a lot of people as well. It's kind of a good opportunity because they pay well, but they are also like an entry level position. Many of the people who work in healthcare, like other nurses, a lot of them work at Norton Community Hospital. Norton Community, it's in the city of Norton. It's probably about like a 15 to 20-minute drive from Wise. But also, something that you really notice is that a lot of people that live in Wise or Pound or Big Stone Gap, they travel for work. Even me and several other people that I know, they travel to like Kingsport for their job. Some even drive all the way to Johnson City. Many of them drive to Pikeville, so on and so forth. There's a lot of people who really do travel for work because of the lack of opportunities. So in Wise, what do you see in a day? When you drive through Wise, when you're looking at the streets, you see a variety of people. There are a lot of people who run throughout the day. A lot of people go out to walk their dogs. You see some of the same people every single day walking for recreation, or maybe walking the dogs as well. So there are many sidewalks that are provided to travel on from one place to the next. If they do not have another form of transportation, WISE has really helped to improve their sidewalk situation in the last couple of years. Like even when you are going down the hill to Food City, it is not an easy task, but they did make an effort to pave the sidewalks to go all the way down the hill by the library to take you down to Food City, which makes it a little safer because there several years back we had a lot of people that were walking beside the road, and it was really a hazard. Because they were walking like right in the grass. They did not have sidewalk to work on. So WISE worked to expand that road and have a walking path so people can either ride their bikes or walk to Food City. And it is really hard because of the hills and the incline, but they've really helped to improve that. Um, During the spring, there's also a lot of people here that ride bikes. They ride them for sports, exercise, and then, like I mentioned earlier, there are people who ride bikes as like a primary form of transportation. You see a lot of animals in Wise. There's many dogs in fenced-in yards. You'll see them driving throughout Wise. You see cats. There's also, you see a lot of wildlife, believe it or not. There's a lot of deer. Deer will be right in front of you, right in town daily. You also do see bear in Wise. You see black bear all the time. They are very close by, and they come right through town. You also will see like raccoons and stuff as well, and fox. So here's some demographic information from Wise for Wise. So, when you look at the overall population of Wise, according to the U.S. Census Bureau, the population was 2,971. We have a really limited racial and ethnic diversity here. The population of Wise is at least 93% of the people are white. Two or more races make up about 4% of the population. Hispanic, 1%. Other races such as Black, Asian, Native American, all combined, they make up less than 2%. Due to this, there's a major lack of cultural diversity. This right here can also lead to a lack of culturally competent care when you look at a healthcare setting. And also, too, when you think about it, healthcare disparities may be less visible or known in these situations because we really don't encounter a lot of other races to be familiar, or ethnic groups as well. And UEA WISE does also introduce some diversity. It really does help because it has helped bring like in a little bit of more knowledge of diversity, but really still we're still pretty limited compared to other areas. So another statistic to discuss is poverty. In our area, we are very poverty stricken. This is a lot of Appalachia, unfortunately, is this way. This way, when you compare WISE to nationwide data, a major finding is that there's much higher reliance on food assistance. When looking at national statistics, around 12% of Americans receive SNAP benefits with just food stamps. However, in Wise County, there are at least 22% of the people are receiving those benefits. We also remain at poverty due to our average income. Many of our individuals are employed, but they're working lower paying jobs or even part-time jobs. We don't really have the opportunity for full-time employment as much here in Wise. The median household income in Wise County is around $44,884. However, this is much lower than the nationwide average, which is $83,730. All right, so education. So when you look at the statistics, education wise has improved over time, particularly like high school completion rates. However, we are still way below the national average. Even beyond high school completion rates, our college completion rates are also well below the national average. So, like, even looking at this statistic, in 1980, Wise County, only 41% of the population was completing high school at this point. But in the United States, it was like the rest of the United States, it was 66%. In 1990, there was some improvement. We had 52.9%, and while the rest of the United States was 75. So, but when you look at more recent times, and like from 2015 to 19, Wise County was up to 76.6% of the population completing high school, but U.S. was still way ahead at 80. The rest of the U.S. was at 88%. And college degree completion, Wise County stays below and has consistently been below less than 20%, like around 15% and less. However, when you compare it to the rest of the United States, they are at least like 30% or higher when it comes to their college completion. When education levels are lower, I mean, really, it really affects your ability to find better job opportunities. You earn less income. It also really can have an impact on your health literacy as well. I may have skipped a slide here. Okay, let's talk about religion in WISE. So, in WISE, religion plays a huge role, and for many, it is important to their culture. So, we do have a lot of religious opportunities in WISE. However, they are all related to Christianity. We are in the Appalachian region, so it's a major part of the Bible Belt. We have many different denominations that are seen for Christianity. We have a lot of Baptist churches, Methodist churches. However, we also do have some non-denominational churches that are making an appearance as well. With this, though, there's a very limited religious diversity. We really do not have any visible places of worship for any other types of religion. However, something with religion as well, like I mentioned earlier, it plays a very large part of their culture. The churches in our area also are used as a place of like gathering. It's kind of sort of, I guess you would consider it like a hangout. It's also used, of course, for worship, and then they also are really great to be. They're very helpful in emergency situations. They serve as emergency shelters. They host like outreach programs. They take up donations and like the opportunity of like if there's a disaster or anything of that sort. And they really do work to contribute to the well-being of the community. However, like when you think of a nursing perspective, it is important to consider when providing like culturally competent care. These beliefs really may influence decisions about their health care and acceptances of interventions. When you have people who rely on religion or are very religious, it really may impact the care that they are able to receive or want to receive due to their religion. All right, so let's talk about how people in miles get around. We had talked a little bit about this earlier. Most people in our area, they drive a car. Most people here, they own their own vehicles. It's really the most effective way to travel in our area. We do not really have buses or anything like in major cities. We don't really have like a specific taxi service. We do have, sometimes you'll see medical taxis. It's paid for and arranged for by health insurance companies. You have to call your health insurance like so many days in advance, and they can schedule you this insurance taxi. And but there's little use of like Uber or Lyft or anything of that sort. Like I mentioned earlier, like walking and riding a bike, it's really not exactly the best. It's not that efficient. It can be difficult. You do commonly see it when you live directly in Wise or during warmer weather. It can make it a little easier to get back and forth, but especially during the winter, you don't really see it so much. One benefit that we do have, though, is we have a service. It's through Mountain Empire Older Citizens, or MEOC. So they have these buses, like we have MEOC buses and Metco buses, and they serve the Wise area and other areas too. They serve like pretty much our entire region. These are buses. You schedule them for pickup. They're like little small vans. You have to schedule them for pickup Monday through Friday. I think it's from like 7 to 4 or something like that. And you have to schedule ahead of time to pick you up from your location and drop you off somewhere, and then they will come back and pick you up from the location, like a doctor's office or even Walmart, and then they take you back to your home. You do have to pay for this. I think it's only like $1 a ride. So that is a good benefit. It's a lower cost opportunity for you to get to where you need to be. And also, something that is interesting, these buses are equipped to handle disabilities. They have ramps for easier transportation. They're very wheelchair accessible. They like electric chair. They're very accessible for that as well. And it is a great way to travel as long as you schedule in advance. One downfall for that, though, is those services are not available after a certain time of day. So it does not help in like in an emergency situation or anything like that, or if you just really need to get somewhere. All right, so let's talk about some public service options that we have available here. So the first one we'll talk about is the health wagon. Um, it's like a small office that is mostly grant funded. It's community health based. They offer like primary care services for free for those without health insurance coverage. Now, also they will bill health insurance. They also do have a dental office as well. They offer these dental services for people that do not have dental insurance or uninsured completely. We are also the location of the Department of Social Services. Social Services is the office that you would go to if you are signing up or for maintaining your SNAP, TANF, which is Temporary Assistance for Needy Families. It's like a cash benefit that you get for a temporary amount of time. You can sign up for Medicaid there. They also do have programs to help with heating and cooling costs. This is also the location of Child Protective Services, Adult Protective Services, and programs to help care for older adults. Another location or service that we have available, and like I mentioned earlier, is the Wise County Health Department. Wise County Health Department, they have women health services. They do pregnancy testing, things of that sort, pap smears for women. They do STD treatment. They also do testing and treatment for HIV and Hep C. They also have a program for Hep C. It's through UVA, UVA in Charlottesville. They work with a healthcare provider in Charlottesville, and they sometimes will bring that provider to Wise to meet with people who have been diagnosed with hepatitis C, and they receive treatment for it. And they have to get scans and things of that sort. But it is actually all done at the Wise County Health Department, so these people do not have to travel. Wise County Health Department also does vaccine administration. The WIC office is located there, and they also have a harm reduction program as well. So with Wise being the house or like the county seat, that's where most of our public service centers are. So that is somewhat of a benefit when you leave here. All right, so some other available services is we do have some pharmacies that are available for medication pickup. We have a Food City pharmacy, and then we have two that are directly in the town of Wise, which makes it convenient for people to be able to pick up their medications. However, also Medicare in the most recent years has started a program through Social Security Administration. If you have someone that is getting Medicare, that they can do a mail-in service for medications. So that does help a lot. We do have many doctor's offices. In Wise, we have doctor's offices and dental services that do take health insurance Wise. We also do have a general surgeon office here that's available for consultations, and they do their surgeries at Marie Community Hospital. But you have the fire department. We have an ambulance service too that is through the town of Wise. It does have one ACLS truck. They also have more BLS trucks available as well to respond to calls. We also have Wise Police Department, Wise County Sheriff's Office, and Virginia State Police, as well as UVA. Wise has their own police department that can respond to calls as well. However, one thing I do want to mention is a lot of these offices is so yes, we do have like optometrists and dental service available. However, one problem is they only help like they take private health insurance. There's really not many opportunities for people to get dental services done besides the health wagon that and takes like Medicaid or anything of that sort. So if you have private insurance, it's a benefit, but however, some people do not have that. Educational opportunities. So the town of Wise is served by the public school system. There are in Wise County total, there's 13 schools throughout the county. We've got, but here directly in town, we have two schools. We've got Wise Primary School, which goes up to fourth grade, and then elevating to middle school. And then after they are finished at the middle school, they go to Central High School. However, that is located in Norton. But when you get into high school, they also have like a vocational school and a technical school program. When you there you can learn. They have access to programs that help you learn skills such as like HVAC skills, auto mechanics, culinary arts, CNA certifications, criminal justice training, things of that sort. But that is at a high school level. But the vocational school is located in Wise. We also do have two private schools. We have Wise County Christian School. It is a private school that is tuition based. It's located real close to the Wise County Airport, but it's right outside of the town limits. And then we also have Minnick School. It's a very, very small private school. It's really referral based only. It takes children 4th through 8th grade who have usually it's behavioral issues or emotional disabilities. Currently at the Minnick School, they have, I believe, 12 students that are enrolled. So let's see here. Looking at schools in Wise, Virginia, this right here is going to have a clip of UVA in it. Back through this road here is the health wagon. I'm just going to play this clip for a minute here so you all can see what UVA Wise looks like. Up through here are some more homes. And this building over here to your right is one of the major apartment complexes. It's called like Walk to Campus, and this is like it's a student-based apartment complex that they can rent, and usually a few students go together to rent an apartment there. This right here is UVA. Right here across this bridge, you're going to see the baseball field. Here, there's a gym and a pool back through here. And then the main entrance. And then there's a library here. There's also a Chick-fil-A over here in this building as well. But this is UVA's campus, UVA Wise campus. And here is a quick video Over on this one, that shows you the middle schools. This right here is a large gym. They've recently remodeled this and they've been working on the gym area. This is the gym for the middle school. And this right here, on the other side of this building, this right here is L.F. Addington Middle School. And then over here across the road, they're right across from each other, is Blythe's Primary School. The drop-off lines, when people come to drop off their kids, it's kind of convenient because you can park in the middle parking lot and the kids can go from the middle school and the primary school. So it makes it really convenient for people who have to drop off kids of multiple ages that may attend different schools. All right, so let's talk about daycare centers that are available. So, Wise is really somewhat daycare and limited when it comes to the number of daycare centers. Um, so through the Department of Social Services, you can go to the Department of Social Services website and look at daycares that we have available. We do have 3 licensed daycare centers, but they are very small and they do take a limited number of children. One of them is the UVA Wise Early Learning Center. So this one is primarily, it's geared for staff and faculty and students that have children. However, after they have completed their enrollment, if they have spots available, it is open to the public. We also do have Kids Central, which is more of a grant-based program. It's like a early Head Start kind of program that gears towards education and um, early intervention for children who may have delays, things of that sort. Kids Central has many programs. They can even do home visits and things of that sort. They have locations all over Wise County. There is also one licensed daycare that is out of a home. It is located in Berry Hill Subdivision, which is really close to the town of Wise. And we also do have 2 unlicensed daycare centers. They are not licensed to the Department of Social Services. So one of them is Mount Olive Church. They take very few kids. It is just a small church-based daycare. And then there's also Wise County Christian School, the same place that is tuition-based. They also do have a small daycare there. However, they are also not licensed. One issue that we run into with this is that all of these options all close around 4 or 4:30, which really makes it difficult for people who work to have any sort of after-school care. All right, so let's look at recreation centers, parks, local hangouts. So we do have a small park. It's a little small playground next to Wise Primary School. Opening this spring, they're actually opening a pickleball court and half basketball courts, which is great. It adds to the recreational opportunities. So recreation in Wise, we also have the Wise Pool. It's located right beside of Arrowhead Park, which is right beside of Wise Primary as well. It's open during the summer months, which is great. We have other outdoor recreation opportunities such as fishing. A lot of people fish at UVA Wise. They have a pond there that you often see people fishing there. Up at Wise Reservoir, they have an opportunity for kayaking, boating, fishing. Um, you do have to, if you take a boat out on the Wise Reservoir, you have to just make sure that you respect the no wake zones. Mhm. Let's see here. Um, we do have other community recreational areas like the Veldon Dotson Recreation Park. Um, So this park is great. It has 5 baseball fields on it, and they also have a soccer field, and they have recently put in playgrounds as well for people who are there for community events. That is the primary place that t-ball, baseball, and softball is played during the spring. They also host other events as well. And then you also have the Big Glades, which is like, it's sort of like an amphitheater. Um, it is kind of right across from, it's really close to the courthouse. It's almost right across from the courthouse, but it's like a large amphitheater. They have concerts there during the summer. They host movie nights and stuff throughout the summer as well, which is really great. And all of those activities are free. And here is a little video of the reservoir. This is the hill going down to the reservoir, and I just wanted to record this. You are not allowed to swim here. You can fish. You can use motorboats as long as you, like I mentioned, respect the no-wake zones. It is a popular location for kayaking and paddleboarding, and many people here, they come here to fish, watch wildlife. And then also right back there on the side, there is a walking trail that you can kind of go and walk along the reservoir. And you can even see here, with snow on the ground, there are still people down here fishing. It's not a really big lake, but there are definitely some branches off back there. It's bigger than what it seems here in this video. And it's very conveniently located as well. This is really only about 2 to 3 minutes from UVA-Y, so it's very close to town. All right, so let's talk about politics in Wise. There are political indicators in Wise when you are driving through. Not so much now. Most of them are not there anymore. But if you came through around like November, around election time, there are often political campaign signs displayed in residential yards and along roadways. There's a lot of homes in town of Wise, so you will see the yard signs pretty frequently. You will see occasional signage for local, state, and national elections. You'll see them even in some business locations. When talking about voting locations in Wise, when looking at the town of Wise, the public schools are the voting locations. They have the polls set up at Wise Primary School. And if you live right outside of town limits, you vote at the Wise County Sheriff's Office, which is really close to town. All right, so media usage in Wise. So for Wise, there are different ways that people keep up with what is going on. We do still have a newspaper. It is called the Coalfield Progress. It is the building, the office is based out of Norton, Virginia. That is where they're printed at. Really, the mostly who relies on that is the older population. But here recently, there has been an increase in social media usage. We do have a news agency, WCYB News. They are also posting on Facebook and other social media platforms. Also on Facebook, we have a local Facebook page called Scanner Food. Many people have used Scanner Food, but they are really good about posting news. People report to them, and then they make a post on Facebook kind of letting people know what's going on. They'll talk about accidents in the area, where to use caution at, so on and so forth. And then we also have Mountain Empire Public Safety, which is a page that posts similar posts as well. We do have a radio station, WAXM 93.5. They are located out of Norton, Virginia, directly downtown. And this is still a way that people use to keep up with what is going on, especially weather alerts and the local news. And as mentioned earlier, we do have WCYB. This is a TV news station. They are on local television. However, WCYB News is based out of Bristol, Virginia. Most of our news sources that are on TV are from the Tri-Cities area. All right, so let's look at health concerns in our population. When you look at our community and evaluate our population, there are many health concerns that I feel like I've noticed. Health concerns that I believe are the most visible include smoking, obesity, diabetes is a common problem, cardiovascular disease. All of these problems, however, are very common in rural Appalachian communities. Um, these conditions are often influenced by lifestyle and community factors. When you're walking through our town outside of businesses, you can see a lot of people that are smoking. You can also visibly see a lot of people that are obese. Let's talk about obesity as a statistic. Here in our area, obesity, the rate here is 43.5% of the adult population, and that is greater than the age of 18. And let's see here. That is really linked to poor diet and limited physical activity. Diabetes is also very common here as well, and cardiovascular disease, which includes hypertension and heart disease. And it is also the leading cause of death in Appalachia. All right, so let's talk about our stakeholder interviews here. The first person that I had interviewed was a nurse. She is a nurse, and she is from Lee County, but she works in Lee and Wise County, Virginia. So the first question that I had asked her is, what is the most common health concerns that you see in your workplace? Her response, you can see it here, she had mentioned was hypertension. She felt like that was the most common, which also coincides with the large number of people that have strokes or MIs. There are a lot of people that I see with AFib or other heart conditions, and she also mentioned dental abscesses, which is something that I hadn't really even considered myself, but she mentioned dental abscesses and poor dental care. And after the next question I asked is, what barriers do you see that impact people from accessing healthcare? And she had mentioned lack of transportation, lack of financial means to pay for their visits, fear of debt, unable to pay for medications, a lack of general education of health, how to be healthy and what some consider healthy. Honestly, there are some patients that I see that really just don't take their health seriously, and the lack of resources at our nearby medical facilities. Even here in our hospitals, we do not have many of the resources that we need. How do you think that transportation impacts care of this area? Transportation impacts care by not only preventing them from accessing basic healthcare services, but it also leaves them stuck in ERs or other facilities, sometimes for hours with nobody to get home. So in some cities nearby, they have access to taxis or health services and Ubers, but when you get to but even here, when you do have the free transport like MEOC, you have to go through insurance first, and it takes hours to get the ride scheduled and arranged. Plus, they are only open throughout the day. So, do you feel like patients follow through with the treatment plan that they are given? And she mentioned no, that she does not think that they follow through with the treatment plan. She thinks that a lack of education is a problem. My face is kind of covering the rest of the text here, but she mentioned that. See here that they do not understand like the meanings of their conditions. They do not understand the treatment, especially in the older population, when many have not even completed high school or really ever had a proper education. And then the last thing I asked her was asking her about improving her community and asking her about resources that she thinks that we're lacking. And she mentioned that we need access to other healthcare resources such as dental or vision insurance, because there's really not a lot of access for some of the people in our area. We do if you have private insurance, but not for a lot of people. We have a lot of people that are uninsured here. She mentioned that we're lacking resources for those who need access to more education. She mentioned that we really need a better education of diet and exercise and overall health in our area. So the next person that I had interviewed was a community member. It was a community member that has lived in Wise for about 9 years. This community member previously lived in Bristol, Virginia, but he grew up in a rural area called Jenkins, Kentucky. So he is used to living in a small community. The first question I asked him was what he felt were the biggest health concerns and was, and you can see his response below. He mentioned obesity and smoking, drug and alcohol abuse, and also black lung, due to the increase in coal mining in our town, in our area overall. The next question I ask is about food options. What kind of food options are available to you? Is there a lot of fast food, or do you have healthy options? And his response was that the majority of the options are fast food. There's limited food options and wise for healthy foods, and there's very little availability to buy fresh food and produce, which makes eating healthy very hard. Most of the time, when I can, I like to buy my produce at the flea market or the roadside stand there close to Wise. The next question I had asked him is about community resources, asking him like what he used and what he felt like he had access to. He said that he does use the public parks, occasionally attends church at Zion Church in Wise, which is a non-denominational church. And he said, I also go to the reservoir in Wise with friends to fish, and when I attended college at UVA Wise, I used the gym on campus. The next question I asked him was about healthcare access. Asked him if he thought that healthcare was easy to access in Wise. And his response was, we do have access to Norton Community Hospital that is nearby for emergencies, but he said that he stated that he feels that healthcare here is inadequate compared to other places that he's lived. He said, when I lived in Bristol, there were a lot of options for healthcare and did not seem so difficult to go to or go to appointments or see a specialist. The last question I asked him was about improving the health of Wise. He mentioned that we do have a good program, which is RAM. RAM is a program that comes around once a year to try to, or occasionally, maybe more than once a year, or maybe less often as well, that helps people with screening and treatment of their healthcare conditions. However, he mentioned that we only have one urgent care in Norton, Virginia. We do not have an urgent care in Wise, so this really makes it difficult for us to see like a primary care physician to get treatment for illness without going to the emergency room. All right, and here is a recorded interview I have here. I'm going to play this video of an interview with a law enforcement officer.
What are some of the safety concerns that you have about the town of Wise?
The first one that comes to mind for me is the crime statistics. Our crime statistics are noticeably lower than the rest of the state, almost by half. Yet our statistics for violent crime is the same as the average for the state of Virginia.
Okay, so do you feel like substance abuse has any impact on that violent crime or just on the community?
Yes, in my experience, I have seen a correlation between that. Oftentimes, when we respond to these violent crimes in particular, the individuals that are involved are either former drug users, recovering drug users, or active drug users.
Okay, so do you feel like the people who are suffering from substance abuse, do you feel like they have any access to support services? Do we have any local rehabs or support groups or counseling that's available for them?
Yes, there's more and more showing up. It seems like every year, people are seeing it as more of a disease than it is like a burden on society as they used to. So, with the health department in the town of Wise, they offer programs such as the needle exchange program, as well as giving free Narcan out, and all of these are free, paid for by the state. And there is opportunity for rehab, even though we don't have any here. There is some locally that will drive and get these individuals and take them and house them.
For the duration of the rehab?
Yes, for the duration of the rehab.
Okay, all right. So do you feel like there's any other common problems that you feel like influence the crime rate in our area, such as like poverty, unemployment? Do you think that those have any influence on the crime?
Yes, I have noticed with the overall crime rate, we do see a large percentage of the individuals committing these crimes that are on the poverty scale and often drug addicted or having some other kind of thing going on in their life, like a mental health disease.
So do you feel like mental health issues are a common problem in lives? Like, Do you think that there are a lot of people who suffer from mental illness that don't get treatment from it?
Yes, I do. A lot of the times that you see this, like drug addiction, for example, as we've been speaking about, there is mental health that is tied in to the drug addiction.
Okay. So, do you feel like that we have enough resources to support people who are suffering from mental health issues? Do we have any a lot of counseling services or any, especially free resources or anything available for them that you know of?
As far as free resources go with counseling, there's not many options. I know there's some great people that work at the health department that try to help these individuals, but they're not actual licensed counselors.
Okay. What do you feel like would improve our community? What improvements do you think um, that the town of Wise can make to our community as a whole, just to improve the lives of everyone?
We live in a great area. I don't want to speak just negatively about it. I'd love to see more family friendly options, such as splash pads for the kids, skate parks, walking trails, or even hiking trails, something to get outside in the woods and really enjoy the beautiful scenery of the area. I'd also like to see more information offered to the public in regards of local crisis organizations that are offered, because it seems like that a lot of people are ignorant to a lot of the resources that we have available. And I'd also like to see um, more information about local support networks that can help the needy as far as food or any other kind of thing that people might actually need.
Yeah. Do we have a lot of resources, like example, like food banks or anything of that you know of?
Yes, there's a food bank that is in the city of Norton, which is just outside of the town of Wise. And also, there is different local churches, such as Zion Family Ministries, that post quite often of large amount of foods that they get in, and they donate it to the public.
Okay. I think that is all the questions I have. Thank you.
Yes, ma'am. Thank you.
What are some of the safe
Alright, so after completing the Windshield survey and performing the interviews to get a total assessment of the community, I have came up with 2 of the nursing diagnoses that I feel have a major impact on our community. The first diagnosis that I have is ineffective health management. This really is related to problems in our community, such as limited health literacy and socioeconomic barriers that we have discussed throughout this video. It is also evidenced by an increase of chronic conditions in our area. The 3 nursing interventions that I have came up with for ineffective health management are increase in health education programs in our area, such as chronic disease management and illness such as hypertension. Increase in referrals, connecting our community to resources available, such as the Health Bag and the Miles County Health Department. There are many people who really do not realize that these services are available. So just kind of getting out in the community and reaching out to people and connecting them with these resources could really help our overall health and well-being. So the last nursing intervention for this is the promotion of vaccines and also other preventative services as well. So the second nursing diagnosis that I have came up with is the increased risk for chronic disease. This is really, these really honestly tie together. It ties in really well with the ineffective health management. The risk of chronic disease is related to problems such as smoking and higher obesity rates and limited access to healthy food options. This is really evidenced by when you're performing the community assessment, you see the use of tobacco frequently as well as the high rates of obesity. The nursing interventions for increased risk of chronic disease is going to be promoting physical activity in the town, and you can also educate the community on recreational activities available. Just letting them know that there are things that you can do to kind of get out and be out, and just like even if it's just as simple as walking at UVA or taking the children to the park. Also, an increase in nutritional education. We can provide handouts to our community with educational tips and provide referrals to programs that can help with grocery costs, like even educating people that SNAP benefits are available or WIC benefits are available, maybe even helping them get signed up on us because some people really don't know where to start. After offering also offering screenings for blood pressure checks and blood sugar checks. That is the use of secondary prevention services. You can host like the screenings for out in the community for the blood pressure and the glucose checks to test for hypertension and diabetes. It's really just monitor and help these people understand their health. All right, and in conclusion, what we've really discussed today is we completed a Windshield survey and an overall community assessment. We discussed the housing and zoning and geographic assessment. We talked about like health concerns here and whys and discussed the health indicators that we've observed. Talked about the strengths and challenges in our community. We mentioned the lack of transportation, the community services that are available, educational opportunities. We talked about recreational activities and local hangouts. We also had talked about economics, the poverty, and the income levels here in WAS. We also performed stakeholder interviews, noting the outside perspective of our community and the improvement needs. We also came up with nursing diagnoses and figured out ways that we can improve our community health based on the nursing diagnosis. And here are the references that I use for this. Thank you guys very much.